Ladies and gentlemen, hello, and you are watching TTV News with some latest events in the province. And now we come into details. Ladies and gentlemen, in order to manage, monitor, and care for people infected with COVID-19 in isolation at home to ensure efficiency and recognize recovery, the People's Committee of the Ninh Province requested the Department of Health and Locality to implement a number of contents.
Establish a mobile health team using self-managing groups in communes and wards and towns to guide, supervise, and monitor the health of COVID-19 affected people who are isolated at home, as well as to spread and mobilize the pandemic prevention control under the supervision of the medical station. To identify COVID-19 infected people who have converted from the disease, and the people who have recovered from the disease, and the people who have been treated in medical institutions, concentrated isolation zones, and those who are isolated at home using a quick test for SARS-CoV-2 antigen, except for those on entry. After the quick test is positive, the PCR test just goes to the input and the output for the people on entrance when the quarantine period is over, allowing the suspected infected people to have traveled from the location where positive quick test was done to their place of residence or isolation by private vehicle following the one road to locations, premised with commitment and supervision. Monitor the quick test sites information and the suspected infected people's information and the destination locations information, and use protective equipment as directed. Encourage individuals to perform a quick self-test if they fear they have COVID-19 infection. Contact and go to the local health station to declare and get PCR sample before self-isolating at home. If the COVID-19 test results are positive and the patient is eligible, he or she will be isolated and cared for and treated at home in accordance with the rules. The people infected with COVID-19 who are in isolation are taken care at home and given 2 quick tests for SARS-CoV-2 antigen in the medication bag provided by the health station, and the infected people receive a supervised rapid test on the 9th and the 14th day. If the quick test is still positive on the 14th day, continue to isolate and test again on the 17th day and call the health station to issue the further test.
On November 25th, the Tay Ninh Provincial Party Committee hosted an online conference for dialogue between in 2021, involving the leaders of party committee and authorities, the Farland from socio-political groups, and the people. The conference was presided over by Mr. Nguyễn Thành Tâm, Secretary of the Provincial People Committee and Chairman of the Provincial People Council, and Mr. Nguyễn Thành Ngọc, Chairman of the Provincial People Committee. On behalf of the Provincial People Committee, the Department of Planning and Investment approved a summary report on the provincial socio-economic development situation. The Provincial Party Committee Department of Mass Mobilization informed the public and people about issues that have piqued their interest in recent years. Representatives of socio-political groups, fields, and individuals had numerous perspectives to voice and communicate to regional officials during the meeting, including some on the prevention of the COVID-19 epidemic.
On behalf of the farmers and veterans, applaud the leadership attitude of the Provincial Party Committee, the People's Committee, and agencies and mass groups in the battle against the pandemic. The resolution number 128 is also quite welcome. It is easy to go, but there is a risk of disease dissemination. Recently, there were some aunts and uncles who were unaware and did not properly apply the 5 key messages in Vietnamese, so the impact was significant, and the province needed closer instruction to prevent it from spreading.
People said that during the COVID-19 pandemic, product consumption was torched. At the same time, the rise of fertilizer and plant protection medication has risen, putting farmers at a disadvantage. Furthermore, residents of Tân Châu argued that the Tân Châu District Culture and Sports Center had not fully executed the compensation for site clearing for many years, harming both the planning and the appearance of Tân Châu Town. Mr. Nguyễn Đình Xuân, Director of the Department of Agriculture and Rural Development, stated the reason increase in the price of fertilizer and material is a low-born situation. The industry had also organized many inspections and tests, discovered many cases of trading in fake fertilizer, and punished them severely. The head of the Department of Agriculture and Rural Development also suggested that farmers develop adequate reduction plans, find ways to save money, limit use of chemical fertilizer, and push the use of organic fertilizer. To be able to sell items, agricultural Russian must verify that there are no pesticides and the manufacturing is safe. Mr. Nguyễn Thanh Ngọc, chairman of the Bronze People Committee, stated that despite being hit by the epidemic, the economic picture still has bright spot. With the economy maintaining its growth rate and export increasing, the economy is developed more sustainably. The economic structure is more efficient. The investment climate is improving, and the attractiveness of foreign investment is expanding. Budget revenue is high, and social security is assured.
We will report to the Provincial Party Committee Standing Committee on the issues what the peoples have sent to the conference, analyzed and evaluated in order to gain the experience in the leadership and administration of the party committees and authorities in order to better perform their tasks in the future, contributing to greater effectiveness and efficiency in leadership, direction, and management. Party committees and authorities at all levels and better meeting the wishes and aspirations of the local people, creating a high level of consensus in society to implement the party's guidelines and policies as well as the state laws.
Mr. Nguyễn Thanh Tâm also suggested that the leaders of the province, district, and functional sector pay attention to better performing the work of receiving citizens, handling complaints and denunciation, and recommending and reflecting on people's recommendation and reflection in accordance with the regulation established. The settlement must provide publicity and openness in compliance with the rules of the law, as well as notify the public in writing of the progress of the settlement outcomes, so that long-standing pilot cases do not generate a registration in the community.
The content of the examination of the Economic Budgets Committee of Provincial People's Council includes the resolution on prices, products and services for public irrigation in the province, resolution on the policy to support the application of good agricultural practices in agriculture and fishery in the province in the period of 2021 to 2025, resolution establishing the curve and level of expenditure to support the province's innovative startup ecosystem through 2025. Resolution on continuing to execute Provincial People's Council Resolution number 2 in 2021, which stipulates the exemption of fees for visiting historical monuments and beautiful areas of Badai Mountain in Tay Ninh Province, and Urban Development Program in Tay Ninh Province for the period of 2021 to 2025 with an orientation to 2030. Housing Development Program in Tay Ninh Province also for the period of 2021 to 2025 with a vision also to 2030. As a result of the verification, the Economic Budgets Committee of the People's Council basically agreed with the content of the draft resolution in report number 4069 of the Provincial People's Committee on the promulgation of the resolution on the prices of public irrigation products and services in 2021, and also the policy to promote the implementation of good agricultural practice and fisheries in the province during the period of 2022 to 2025, and the policies to specify the content and spending levels to support the province's innovative startup ecosystem, and also the content in the draft resolution assures adequate and consistent with the provision of law and the local situation. The Economic Budgets Committee essentially agreed with the draft resolution report of the Provincial People Committee on the contents of the Province Urban Development Program to 2030 by verification. The draft Provincial Urban Development Program ensures that the fundamental contents are in accordance to the regulation, set out the views, goals and targets of urban development and propose solutions to the implementation.
According to the Institute of Architecture, Urban and Rural Planning under the Ministry of Construction, the average urbanization rate of the Tay Ninh province is 16%, lower than national urbanization rate 30%. Besides among district, towns and cities in the province, the urbanization rate and population density are evenly distributed. The population density of the Tay Ninh province is unevenly distributed throughout the province, according to the consulting and assessment work of the Institute of Architecture, Urban and Rural Planning under the Ministry of Construction. Tay Ninh province has a population density of 266 persons per square kilometer of natural land area. Notably, the population density fluctuates while there are more district, town, and city. In the case of Tân Châu and Tân Bình district, the average population density is 110 people per square kilometer. But in Hoa Thanh Thao, the population density is up 1,685 people per square kilometer. The high urbanization rate mainly developed along National Highway 22B, including Gò Dầu, Bến Cầu, Tay Ninh City, and Hoa Thanh Township. The localities with low urbanization rate are those with bordering geographical position, such as Tân Châu, Tân Biên, Châu Thành, and U Minh Châu district.
On November the 24th, the Customs Department of the Bến Cầu district, to command military Region 7 prepare and program on 5,000 pieces military people capacity operation, totally about 250 million Vietnam dong to offer 500 gifts to households in difficult circumstances as a result of COVID-19 pandemic in the district of Bến Cầu, Tân Biên, and Tay Ninh City also. When the fourth wave of COVID-19 pandemic broke out, the armed forces of military region number 7 joined the whole political system in the determination to control and repel the pandemic. The military region 7 and the military command of the province and cities have extracted from the source of increased production mobilized resources from many aspects to join hands to contribute to the prevention of the pandemic in the southern provinces and cities, with a total budget of over 812 billion Vietnam dong to support the localities and people in the pandemic prevention and control, contributing to lightening the good qualities of alcohol army in the new situation.
Ladies and gentlemen, the COVID-19 outbreak is still difficult, and the number of FO is fast increasing. The ability to care for asymptomatic or slightly symptomatic FO at homes has provided numerous benefits to patients, particularly mentally. Furthermore, it generates a significant quality of work for grassroots health workers. Tân Biên district has created mobile health team to visit all hamlets and communities. The mobile medical team is made up of 3 people: the hamlet health worker, the hamlet head, and the hamlet front working committee head. Despite the initial bewilderment, hamlet mobile medical will rapidly learn how to assist the patient. It's clear that the disease prevention activity in the community places a strong emphasis on grassroots healthcare.
Today I found out I had a fever. I booked a dress strip to check. My father notified medical station and they raised up to test me to determine whether I had a fever before isolating at home. I took medication and I required about my health on daily basis.
My job is to propagate and care for FO every morning. I phone to inquire and then report to the station. The station will carefully lead the propagation pack to the people. The management and treatment of FO at home has brought many benefits to patients. However, with the rapid increase in the number of FOs due to infection in the community, the health stations are having to bear a huge amount of work, which is expected to be overloaded.
The source of risk from workers returning to the area is very much. The suspicion of infection will also increase. It is expected to increase in the near future. The resource of community health workers are very stressful with vaccination, investigation, and tracing for the virus. The work is very heavy, and we offer to support vaccination work.
In some localities, the management and care of FO encounter many difficulties due to overload. The grassroots health sector is having to perform many tasks, including vaccination, isolation, and traceability, and management and treatment of FO.
Currently, we vaccinate students. Outside, there are many F0 phones to ask for health advice. The capacity of the medical station is very thin, and we lack of the people. And there are 6 people in the workforce, but now there are only 3 people working. One is on maternity leave, and one is in the district tracing team. At the same time, I work at the station and work as a mobile medical team also. I was also on duty in the isolation area, and people call to ask where there is a health abnormality. They call all the time, and sometimes I can't answer all the time.
The number of FO increased rapidly, while locality human resources were limited, so many localities were almost unable to monitor those who abandoned medical declaration. Or there were cases where the health station could not respond to and handle the declaration firmly. According to patient reports, according to several locations, the PCR finding provided to the commune for processing were still delayed due to a shortage of human resources. Localities are making efforts to encourage individuals to rigorously adopt 5K measures to safeguard their health and the community health in order to contribute to lowering the burden on health. Ladies and gentlemen, that's all for today TTV News. Thank you for joining with us and see you next time.